On this episode of the Ask Mike Reinold Show, we talk about fatigue in athletes, minimalist shoes, and what I do when I scratch my head with someone with some odd neurological symptoms. The Ask Mike Reinold Show. Helping people feel better, move better, and perform better. Welcome back, everybody, to the next episode of the Ask Mike Reinold Show. We are here with another great episode. We got some great questions today. Lenny Macrina joining us again. No Dave.
You got to do something.
We need like catchphrases. No Dave Tilley again. Dave is out of town teaching, so we'll have him coming up soon on some future ones here. But more importantly, we have Nick and Evan, and that's all we need. We don't need Dave.
Collectively known as Nevin.
So
Whoa, hello.
Whoa.
Let's open the can of worms.
Nevin. I like that. All right, we're gonna do something again. We can't just take turns. Let's go paper, rock, scissors. See who has the question.
You say paper, rock, scissors, or rock, paper,
paper, scissors.
Is it?
Wow.
Yeah, pretty sure.
Rock, paper, is it? Scissors, rock, paper.
He just gave away his.
There you go.
To it.
Rock, paper, scissors.
What?
Right,
Did you disqualified. Disqualified. Yeah. Evan, you're up. What was that? Somebody teach Nick how to play rock, paper, scissors, paper, rock.
All right.
What do we got, Evan?
So, question number 1 is from Chris in Savannah, Georgia. Hey, crew. Occasionally, I will have athletes come into the athletic training room who complain of fatigue in a muscle group, primarily shoulders and groins. Sometimes they have pain and sometimes not. Their main complaint is that they just feel like it tires out very easily, and it's always kind of tricky to figure out. Do you ever encounter athletes with similar symptoms? If so, how do you go about assessing and treating their fatigue?
Nice. Okay. All right. So athletic trainer, right? Because you said athletic training earlier.
Yes.
So he said that. Good. So he's getting some athletes that are coming to him with some fatigue. So okay, no biggie, right? So he's getting fatigue, shoulder, groin, those types of things. If you're an athletic trainer and you're getting athletes coming in with fatigue, I think that's very, very well accepted in these groups.
Right.
Especially in the collegiate level, or at all these levels. I mean, when you're balancing, you're in the middle of finals week, or the season just started here. To me, I think that's completely normal, and I think there's a whole nother realm of what we need to do with our athletes as athletic trainers or rehab specialists or whatever it may be. It's not just getting them kind of back from an injury, but it's also about how do we get them fresh every day. So recovery is huge, and there's so many things you can do for recovery, but I think understanding this and managing stress and managing fatigue, I think is kind of that's our next evolution that we started the last several years that we really want to dominate. The best way we can enhance our athletes now isn't going to be coming up with a fancy new exercise in the gym. It's going to be coming up with some way that they can get back to baseline faster and they can avoid that fatigue. So I don't know, anything else?
I think what jumps out at me immediately is if you're seeing a lot of these, then you need to look at their off-season program, because if you're seeing the team coming in beat down, fatigued, especially shoulder baseball or groin soccer, for example, or a running football team, I think you got to look at the off-season program and why are they fatiguing, as a collectively,
Yeah, that's a good one. So off-season, probably also in-season, and then this is where good communication with the coaching staff comes in. Maybe it's maybe their workloads are too high with all of this combined. So this is why we always recommend everything like multidiscipline with the coaching staff, with the athletic trainers, the strength coaches. So you have to make sure everybody's building their program simultaneously, and that includes coaching in there. So you have to have an open-minded coaching
nutrition.
system.
I mean, it just goes on and on.
So put that together. I'd say that's normal, but
easier said than done.
Yeah, exactly. And you don't know what your athletes are doing at night. And,
right.
I get it.
Don't want to know.
Nice. All right. What's next?
Okay, number 2 is from Daniel in Springfield, Virginia, and he wants to know squat shoes versus minimalist shoes for strength training.
Okay. All right. So squat shoes versus minimalist shoes for strength training. I think that's like two different tools that you would use for different things, right? Squat shoes exist for a reason, right? I mean, it's a heel. I mean, it's kind of like a heel, so it kind of gets you up, so you can get a little deeper in the hole when you're squatting. So, that's one of the advantages of having squat shoes in there. If you wore minimalist shoes to squat, you have to have a little bit more mobility to go deep, so it's a little more challenging, right? Everybody agree? I mean, so I think it depends on what you do. So for me, I'm also not squatting as much as I can. But for me, I tend to squat with just my regular shoes because I just want to have my functional squat strength. But with deadlifting and hinge-based stuff, I do go either barefoot or a minimalist shoe because I want to be able to rock back more posteriorly. So that's how I would do that. But for me, I'm actually getting away from minimalist shoes personally a little bit more for training. I will do my warm-up in minimalist shoes. I'll do like my dynamic mobility, like some of my correctives, those types of things, because I think some of those drills with some minimalist shoes are very helpful, but oftentimes I will switch back to my other shoes for other reasons. I think we're using the minimalist too much. So running, like Lenny, you have any experience with people running in minimalist shoes?
Some. I don't treat many runners. I'll defer to Chris Johnson maybe.
Little shout out.
Yeah, Pacific West Coast. But I think we're seeing researches either way. With that, I think you're going to get a different stride, a different gait. It depends on the person. I think it just comes down to how do they present in their examination. Can they get away with a minimalist versus a deeper heel and.
Yeah,
I tend to go neutral with that.
So the research, I think the popularity is completely decreased. We're seeing far less people that are trying to run in Vibrams and stuff like that. What it comes down to is yes, the studies might be either way. You might have some studies that show stride length changes, but there's also some stress fracture changes happen over time and stuff. So I think we're starting to see that. It's very hard to run in minimalist shoes on pavement. I think that's kind of the thing. That's kind of why some of our shoes are so. So I guess to answer your question, there are two different tools for two different reasons. So I don't think it's a yes, no. It's a both somehow in how it applies to you.
Yeah.
Awesome.
Okay.
All right, what else?
Number 3, Katrina in Finland wants to know, can tight iliopsoas and or quadratus lumborum and or TFL be behind bilateral activity-induced strength deficit and burning sensation on the lateral thigh, peroneus area, and an inability to dorsiflex the ankle?
Whoa.
I have to break this one down a little bit.
Boom. Well, actually, I don't know if you do. I think the end just nailed it. All right, listen, so let me try to paraphrase. I like to paraphrase for both of us.
So everything was jumping out at soft tissue-y, muscly, probably mechanical flaw, and then the lack
Until
of
the end.
The lack of
And
the
you just
ability
went,
to dorsiflex the ankle just screams nervy.
Yeah. And
further examination of the lumbar spine and
there is no good reason why you can have foot drop or lack of inability or no,
maybe not
lack
that
of
would be an
ability.
extreme, but weakness in dorsiflexion, limitation in dorsiflexion.
Yeah, I mean there's no good reason why that'll
That would
happen there.
refer out for further examination and further testing.
The Bernie thing right there I started to scratch my head a little bit when you said burn. But then, I was still thinking sometimes people perceive burn a little different, so that's just a term sometimes. But when you bring up the inability to move something like that, a joint like that, then you may have something neurological going on there. So that's definitely something I wouldn't say a tightness could do that. That's super unusual.
Mm-hmm.
So that would be something I would probably refer out to. And
Sounds like all the other stuff is happening because of an underlying pathology.
Exactly. Yeah, maybe they're changing the way they're doing their activities, and that's why they feel tight in these areas or something along those lines. So good. What else? Student perspective. You guys, any other thoughts on that?
Yeah.
You guys are fresh in some of these neuro courses that Lenny and I haven't had in a while.
I mean, you gotta figure when you start having weakness in your dorsiflexor, that's a true nerve root compression. I mean, you might see decreased reflexes and change in sensation. That's the point where it might be slight compression. You can conservatively work on that. But if you get to the point where you're getting compression of the nerve to the point where it's stopping your motor response, then I think that's a
that's a flag.
reason for
That's a flag.
referral.
Because it's not just weakness, it's inability to dorsiflex.
Right. Yeah, right. That's weird. Yeah. So
it's a good point, though. I want to make sure because I think you said it well, that refer to get further examination, but I think conservative treatment is going to be one of the better ways. I don't want people to think that I refer out because we want to push it away from us.
Right,
I think
no.
we just need to further
Work as a
understand what's
team
going on
at
and
that
then
Yeah.
And then we can treat it appropriately, hopefully conservatively, because we know that nobody wants to have back surgery.
That's one of those ones, I call that the head scratcher. I don't know if we've talked about this. I talk about this a lot here. Is you try to work on it, you try to do what you would normally do, but the second you scratch your head because something doesn't add up, we're missing something.
Yeah.
And you have to look deeper. And every time I do that, we find something. And you have to look deeper. When it doesn't add up, there's probably a reason why it's not adding up. So awesome. All right, well, great question. Another good episode. Thanks so much. That's it, right?
Yep,
Three?
that's it.
Good, perfect. Thanks so much, guys. We appreciate everything again. Love the questions. Keep giving us some good ones. Any question requests? What kind of questions do we want? Anything different? I don't know.
Doing a pretty good job.
They've been great.
Yeah, they've been all over the place. I like it.
Yeah, keep giving us other ones. Anything you guys want to talk about? Business, baseball, doing the not just fitness, PT, anything, career advice. Where we're happy to answer anything. So, thanks for joining Lenny and I, and we will see you guys on the next episode. Thanks so much. Take care.